all that stuff. But the point is, when to focus on what? Are we going to work on both at the same time? Are we going to work with the ankle strategy and ignore the hip strategy, or working with the hip strategy and ignore the ankle strategy? Which one? Which one to do? So I usually use the modified sit-step test to tell which one I'm gonna focus on. So if my patient is standing on a stable surface, okay, and I see a significant sway, okay, when they close their eyes, this sway increases. They are on a stable surface, there is a sway. So it means that I need to work on the ankle structure. Okay? Somatosensory system controls the ankle strategy more than the hip strategy.
Can you repeat that? I didn't quite.
Again, somatosensory system controls the ankle strategy more than the hip strategy. And of course, you know the muscles, right? So with the ankle strategy, you focus on the muscles around the ankle and going up. And the firing starts distal, moving to proximal. Okay? In condition 3 and 4, what is happening? We have the patient standing on a phone, correct? And in my patient, the sway increases as they are on the phone, eyes open or eyes closed. I'm going to work on the hip structure. So now we need to know that the vestibular system controls the hip strategy more than the ankle strategy. So our patient with closed eyes or open eyes on a phone means that the somatosensory is now not used. The feedback coming from the feet. The brain ignores those, right? And focuses on the feedback coming from the vestibular system. The vestibular system controls the core and the hip muscles more than the ankle muscles. So the vestibular control on balance is not appropriate, means that you need to work on the hip muscles and the core muscles. Okay? And at the end, you're going to work on both of them are required for the stepping structure. So we'll start with the hip, and with the ankle, with the hip structure, and then we're moving forward with the stepping structure. Okay? So right now, I mentioned that working on the ankle structure. But before this, if I had a patient, like the first guy, we saw him weight bearing on the less affected side only here. I want to enhance the weight bearing on that side. We mentioned for this guy specifically, we need the Botox injection, we need the calf muscles strength, right? But if my patient is still kind of 2 or 3 weeks after a stroke, and they are all the time having weight bearing on the less affected side, not the affected side. You saw me here adjusting the foot first, right? And then my instruction to my patient is to turn the head to the affected side. I am using here what's called tonic lumbar reflex. So with the tonic lumbar reflex, if I am turning the head and upper trunk to the right side, means what? Means increasing extensor tone of the right lower extremity, flexor tone of the right upper extremity. Again. So what do you want here? Increasing the body weight increasing the extensor tone for the body weight on the right side. So ask the patient to turn to the right. Okay. So head turn to the right means extensor tone of the right lower extremity, flexors of the right upper extremity. Flexors of the left lower extremity, extensors of the left upper extremity. So the opposite. This is the tonic lumbar reflex. It happens when the stimulus is head rotation, head or upper trunk rotation to one side. It has many other helpful or benefits right here, that this patient now is crossing the midline. Right? So it means that he's looking at the affected side, realizing that we have some weakness there. Head turn to this side means weight bearing on this side. Okay? So this tonic lumbar reflex can be used to improve the weight bearing on the affected side here. Of course, having visual feedback in front of the patient. We talked about it last time. When we have this line on the meter, having the patient crossing the midline like that. Okay? You progress with those by doing stabilization reversals, rhythmic stabilization in standing without any support. So she is standing now. The therapist is now applying resistance to her. The therapist now is applying resistance here in this direction, so pushing her shoulder, left shoulder back, and pulling her pelvis forward. So the patient would resist by the opposite movement, correct? And no movement should be observed here. This is what? Stabilization reversal. Rhythmic stabilization. Rhythmic stabilization. This is shoulder against pelvis. Okay. Another progression to have the patient applying those. Again, weight shifting. See here, the affected side forward, the less affected side back at the beginning, and then you switch. Having a step in front of the patient that enforces the weight bearing on this side, on the affected side here. Okay, you do that side to side, and you do that in front of the patient too. This applies a lot of stretch on the calf muscles on that side. The patient has E-stem, functional E-stem on the peroneal, common peroneal nerve, right? That helps the dorsiflexion during walking. Did you see the guy when you wear trifor? Okay? He was here in this room having the, do you remember how his walking was different, completely different if he got this off? Well, okay. In your textbook, there is a table that is giving you page 208. This is, of course, second edition, table 9.3. Giving you exercises for the ankle strategy at different levels. So primary level beginners, those people at the intermediate level, high level of exercises. So this table for the hip, for the knee, for the ankle, for the stepping strategy, please focus on it because it's going to be questions about that in the first exam. Okay, so I know you guys practice that a lot in PCM, no, not PCM, and movement science, right? 2, many balance exercises. Okay? In our next lab, after the gait training, we would have the Parkinson's and MS. So those 2 cases, I'm gonna post the cases, okay? They have been balance problems. Okay, so the groups should know how to give them good balance training. So you come with exercises in this lab. Okay, you can select any of those, no problem. Okay, right? Okay. The other thing also, we should consider which system we are working on. So are you going to strengthen the feedback from the somatosensory system? You're going to strengthen the visual inputs, or you're going to emphasize the vestibular inputs to the brain. Different exercises based on the surface. So you can tell here, for the vestibular, the patient is foam. The patient is on foam, right? The patient marching in place on foam, okay? And you could tell that also the eyes closed, right? So in many of the vestibular training, we have the eyes closed or the patient is on foam. When the patient is on foam, the body again ignores feedback coming from the somatosensory system. If you want to isolate the somatosensory system, you put the patient on the foam. You, in other words, any compliant surface. So any compliant surface means that you are really improving the feedback from the vestibular system. But when you go to the somatosensory system, eyes open, then eyes closed. But what? The patient is standing on a stable surface. It has to be stable surface. Okay? When the patient comes to you telling you that I have a problem when I walk on the grass, okay, that's an irregular surface, right? So that is a vestibular problem. I have a problem walking at night in a semi-dark room and on a carpet. So you ask, is it a thick carpet or a thin carpet? So if it's gonna be a thick carpet, right? So different surface other than a stable surface. Those are compliant surfaces. Okay? So to improve, again, whatever the case. If I have a patient with peripheral neuropathy, okay, and I know this is a progressive thing. So peripheral neuropathy is going to be progressive in patients with diabetes, right? So diabetic neuropathy is a progressive neuropathy, right? So I know that the patient would not have a good feedback from the feet. And in this case, I'm going to compensate by helping those, okay, and work on strengthening and emphasizing the vestibular inputs. But if I know that this patient is gonna having a progressive form of peripheral neuropathy, I need to work more on the somatosensory system. Because the somatosensory system is predominant if you are standing on a stable surface, right? So, and this is our life. Most of it on a stable surface. We're not on foam every day. Right? We don't have much of thick carpets at homes. Correct? So you need the somatosensory more than the vestibular. Whenever you are on a stable surface, it's the somatosensory system that is predominant. Okay? So your patients, they need the somatosensory more than the vestibular. But we cannot ignore this vestibular tip. In a stable surface, it's going to be 70% using the somatosensory, and the others using the vision and the vestibular. Okay? With old age people, sometimes when you ask them, you'd say, okay, whenever I close my eyes, I may fall. I feel wobbly. Those people are really locked at their vision for that. Because you would have that in geriatrics, that the somatosensory system is kind of regenerate as we age. I'm sorry, degenerate as we age. So they are dependent more on vision. Okay? So whatever you have, your examination is telling you, okay, which strategy of balance you're gonna work on? Is it the hip? Is it the ankle? Is it the static strategy? Or which feedback I'm gonna strengthen? I'm going to strengthen those of the somatosensory inputs. I'm gonna focus on the visual. If my patient having, let's say, a patient having history of hearing loss due to an accident. They fell on their back and they have one of the ears is not working. Okay? When the ear when the hearing is not there, the vestibular function, get out the door with the hearing. They go together. Okay? So the vestibular in that right here is not working good. And this patient also got diabetic neuropathy, no somatosensory system, no vestibular. So in this case, okay, we're gonna emphasize the visual more than any other thing. Because I know that they would not regain the vestibular function, they would not regain the somatosensory function. Okay? So here it's kind of substitution, right? I substitute those that are not working with something working. Okay? Okay? This patient having
The patient
balance
practices
exercises,
standing while pouring from a pitcher into a glass, and then reaching with the left hand across midline.